Welcome to Coaching Healthcare Leaders, where we transform great physicians and healthcare professionals into exceptional leaders. I'm Dr. Lisa, an executive leadership coach dedicated to helping healthcare leaders navigate the complex intersection of clinical excellence and organizational leadership. My mission is to give healthcare leaders a voice to help build sustainable health systems where everyone feels valued, healthcare workers want to stay and grow, and patient outcomes improve. Each episode, we'll tackle real challenges faced by medical leaders like you, provide actionable strategies, and feature live coaching sessions with healthcare leaders. Let's grow together. Hello, everyone, and welcome to the Coaching Healthcare Leaders Podcast. I am your host, Dr. Lisa, and I have an amazing guest with me today. So I am interviewing Dr. Katrina Gipson, and I'm going to just read her bio, and then we're going to get into some awesome questions and learn all about her leadership journey. So Dr. Gibson is an assistant professor of emergency medicine at Emory University, where she is the founding health policy fellowship director. She practices at Grady Memorial Hospital, one of the country's busiest emergency departments. Dr. Gibson is the president of the Academy for Diversity and Inclusion in Emergency Medicine of the Society for Academic Emergency Medicine. Dr. Gibson recently completed a term as the Emergency Medicine Section Secretary of the National Medical Association, the largest organization representing African American physicians and their patients in the United States. Dr. Gibson's op-eds discussing health equity and advocacy have been published in the Boston Globe, The Hill, The Progressive, and she's been quoted in the New York Times. She is an avid public speaker, having collaborated with the African American Policy Forum as a critical race theory summer school lecturer, Spencer Stewart's Black History Month speaker, Texas Speech Language Hearing Association keynote speaker, SiriusXM's Urban View podcast guest, and many others. Dr. Gibson hosts the podcast Culture Shock Therapy, Your Health Equity RX, a platform to inform and empower the public about policies and the social drivers of health influencing health inequities. Dr. Gibson is a participant in the AAMC's 2025 Healthcare Executive Diversity and Inclusion Certificate Program and is an emerging health equity thought leader. So welcome, Dr. Gibson, to the podcast.
Well, thank you so much, Dr. Herbert, for having me. I'm excited for today's discussion and the platform that you provide for discussions like this.
Yes, absolutely. So reading your bio, there's so much that we can talk about, and hopefully, we can actually, touch on a lot of these different areas.
Sure.
But the first thing that I want you to share with us is, just share with us your leadership journey and sort of how you arrived at the point to where you are today and who or what may have been influential in you getting to the point where you are today in your career.
Of course. So I'm sure we all are aware that, Black women are a rarity in STEM fields, right? Things such as science, technology, emergency medicine. And I remember even as a small child, that statistic resonated with me for a number of reasons. Number one, I'm always wanting to accept a challenge. And when you hear, whether it's like locally or at the national level, that, people like you can do certain things, then I'm the type of person who wants to do those things. So, I had, supportive family and friends, fortunately, but, as I kind of entered college, I kind of maybe swayed towards kind of maybe justice and equality. And maybe I thought, am I going to be like a civil rights attorney? And the point that I'm making that my journey is by no means linear. I think that as we get a little bit more seasoned in our career, we really realize that. But regardless of what it was that I thought that my career title was going to be, I always knew that my North Star was some sort of justice and or some sort of equality, and I eventually ended up leaning towards health equality in that journey. I was a biomedical engineering major at Yale. Don't ask me why. However, there are easier or more ways to skin a cat to get into medical school than choosing the engineering field. However, it instilled in me a lot of critical thinking and that sort of thing. So I eventually did a 360, was back to where I began as a younger child and wanted to pursue a career in healthcare.
Mm.
And of course, access to healthcare as a human right and therefore a form of social justice. And there have been a lot of adversity and obstacles that have been interwoven into the tapestry that is my journey. And I think that has instilled in me resilience, perhaps a fear of failure. And, a lot of times we've been discussing this idea of imposter syndrome, but I think in ways I haven't really embraced it, because I think that when you start to get into these rooms, you start seeing that the people that have been in those rooms and gatekeeping the doors to leadership positions don't know more than women in historically minoritized populations. So I think that one of the important things that has been a constant in my journey is I've never once walking into a room and felt that my voice didn't matter or that I was not enough. So I think that centering the idea that healthcare is a human right and a form of social justice, knowing that minoritized populations and groups who have been historically excluded from medicine benefit from having concordance with their providers, meaning that their providers share similar race, gender, ethnicity, and not just minoritized populations, but all populations benefit from healthier societies. And healthier societies require diverse healthcare providers, and it just leads to decreased health inequities. And those are the things that have kept me going when you hear those discouraging statistics about, folks who look like us are not in medicine, should not be in medicine, and may not succeed.
Yeah.
So when I take all that into consideration, I just kept going and looked for opportunities to thrive.
Yeah, I love that. So what I hear from that is, and a lot of times I have to, even in my interaction sometimes with people who just might be colleagues or, or those people who I make coaches, really understanding what your strengths are. So you can leverage those, right, to
Mhm.
really make an impact and make a difference. And it sounds like that's exactly what you've done, is using those strengths to help you to move forward in your career and finding that path, that aligns with it. Yeah. So thank you for sharing that. So tell us a little bit about, the work that you do. So, in your current role, leadership role, sort of what's your day to day? What does that look like? Who do you serve and what challenges you might face?
Sure. So I'm at a stage in my career where I'm wearing many hats and am looking to unpack some of those hats. But one of the most prominent one is my role in the Society for Academic Emergency Medicine, or SAEM. And within that organization, there are several academies, and the ADIM, or Academy for Diversity and Inclusion in Emergency Medicine, is the second largest academy. And our role is to guide the board in, setting the research and educational agenda through a lens of diversity, equity, inclusion for academic emergency medicine. So one of those things is kind of like, obviously I still see patients. So I'm always, and I think all of us in academic emergency medicine, or those who see patients regardless, we're always trying to strike a balance between our clinical responsibilities as well as what it looks like to thrive in academic medicine, because all roads lead to promotion. I'm sure, you come in as an instructor, and then the path is, hopefully to go from assistant to associate to eventually be a full professor. And as my role in the Society for Academic Emergency Medicine, while there are several other organizations, this organization felt like home for me for a number of reasons. I feel that it was like a smaller organization in which we could, and until recently, there have been some, thanks to the executive orders, which I know we'll talk about a little bit later, has kind of changed the manner in which we're able to do our work. But nonetheless, our organization stays committed to, creating a platform in which we can address and discuss health inequities as they impact not only our patients, but healthcare workers as well. So, for instance, I mentioned earlier that all patients benefit from a diverse healthcare worker pipeline, physicians specifically. And, physicians are not built overnight. So in order to build that pipeline, it starts early on. It starts, I would say, even before college, maybe high school or even sooner. So it's important for us to, make sure that we have mentorship programs that identify individuals who are talented, but from minoritized populations or those who have historically been excluded from medicine, and make sure that they have mentorship that to to enter the field of, if not emergency medicine, medicine in general, because as we all know, it's extremely difficult to, achieve what you do not see. So when you see people who are thriving in fields that look like you and are providing you with the resources and the encouragement, and I think that anything is possible. And of course, I'm sure we all are familiar with a lot of the statistics that show that certain populations, Black and brown folks in particular, are more likely to be, dismissed from medical school and their residency programs. And a lot of times that's not due to an inability to perform academically. They're due to other challenges, possibly due to the social drivers of health, systemic racism, and a lot of the stress that comes from being the lonely only within a program. Sometimes you have a target on your back. So these types of mentorship programs are important from beginning to the end. And then once you do become a faculty member, you finish medical school, you've made it through residency, and now you're faculty. You think that the work is done, but it's not. The next step is how can we retain our faculty, and how can we promote them and make sure that we are showing that the work that we do in the DEI space is just as important and pivotal in other aspects and fields. Because if you can't treat somebody's heart issues if you haven't addressed the social drivers of health that are making it difficult for them to get to their doctor's appointments or to afford their medications. So I think an emphasis on the pipeline is extremely important. So we make sure that we develop that. Also, research. Obviously in academia, research and evidence-based medicine is important. So it's important that any research that we do is done through the lens of diversity, equity, inclusion, with a focus on decreasing health inequities for the communities that we serve, educating our communities and our populations, because education equals empowerment. So the focus and the objectives and missions of specifically the Academy for Diversity and Inclusion in Emergency Medicine does make sure that all of the work that we do, whether it's mentorship, setting the research agenda, or educating our patients as well as our learners, is done through that lens of health equity and social justice, so that we lead to a more robust, diverse healthcare workforce that leads to decreased health inequities within our populations.
Yeah. Wow, it sounds like you're doing some wonderful work, in that organization. And thank you for just sharing some background, just about all the work that you're doing as well, but also the challenges, that we're facing now as it pertains to, like you said, increasing that pipeline or even just retaining, folks as they come in who might be part of that, minority background, to make sure that we are part of the numbers in terms of also being an impact and helping to reduce the healthcare disparities. Yeah. So thank you for sharing that. So how does your work in that role or in any of the roles, that you have directly impact the patients or the communities that you serve? I think you mentioned it a little bit, but if you want to just share a little bit more about that.
Sure. I think that, a lot of we're just recently starting to see physicians in the healthcare field a little bit differently. A lot of times, institutions, we're kind of in our ivy towers in our respective towns, and it seems inaccessible to the populations that need us the most. And these populations, particularly minoritized folks or BIPOC, Black, Indigenous, people of colors, have reasons to have trepidation when it comes to seeking healthcare, particularly in these, well-established, powerful institutions, due to our institutions' history with these communities, whether it be, unethical research, whether it be, lack of communication with patients, whether it's misunderstanding cultural nuances. People who look like us, Black and brown folks, often have, poor interactions with the healthcare community, and rightfully so, will have some trepidation with working for them. You don't know if, when you go to the hospital, there was a time where you didn't know if you're going into the hospital, if you were going to leave with the organs that you came in with. I think that some of us are starting to talk about, Fannie Lou Hamer and the Mississippi appendectomy, women going in, women of color, and being sterilized and having hysterectomies, thinking that they were just going in to deliver a baby and came home and unable to reproduce. We are all familiar with, Henrietta Lacks, or, the Tuskegee experiment. These are just larger kind of inequities that we're just now starting to acknowledge. But those types of issues also occur at the bedside where, a physician might dismiss a patient who doesn't look like them because they don't understand or may not want to, talk to a family member that they have on the phone with them to make sure that they're being heard and advocated for. So one of the ways in which we are directly impacting our patients is making sure that our learners, and not just physicians, but pharmacists, nurses, paramedics, are beginning to embrace cultural humility, understanding that we might have implicit biases, that populations who don't look like us might have different ideas about healthcare and the way, maybe the way that they eat, the religions that they practice, and all of these things are social drivers of health that impact how people receive their care and the resulting healthcare outcomes. So you cannot change what you don't acknowledge. So when we educate and empower our communities as well as our healthcare workers, that's when we start to kind of acknowledge a lot of these nuances that can impact how people receive care. And that also builds trust. You can't have a conversation, particularly about personal aspects of healthcare, without trust. So when you start to, instill this information and this education, I think that trust is built, and it empowers people to be invested into their own health and be able to advocate for themselves. And on the other end, it also educates healthcare workers, so the blind spots that we may have as well about taking care of different types of populations. And those are the ways in which we are going to bridge the gaps in healthcare and equity. So it's not something that's going to happen overnight, but it's only through research, through education and advocacy. And I know with non-for-profit organizations, it's kind of unclear as to what advocacy means, but education and research is a form of advocacy, particularly in this climate of misinformation and disinformation.
Yeah, yeah, definitely. And I think you mentioned, two, I think, big drivers of, whether you want to call lack of access or, people in minority groups not receiving the care that they should.
Mhm.
One is mistrust, which is a huge problem. And then the other you mentioned, the social determinants of health, which is also a huge area to tackle. So looking at, those two areas or even just embracing some other areas, what do you think are some ways in which we can change then, how we deliver care? What are some suggestions that you have that we could, start to make some changes?
Sure. So the current healthcare system, there's so many challenges in order to not only deliver care, but to receive it. I think one of the challenges that exists would be an area for change is, we talk about healthcare worker shortages and burnout. And
Mhm.
I personally am an emergency medicine physician, and when the numbers come out, we were always, at the top for burnout. It's always great to be number one, but this is not one of those areas in which we do want to be
Right.
number one, right? And I think that the COVID-19 pandemic really put a microscope on the healthcare field,
Yeah.
and it really started making all folks, whether you are a member of the healthcare field or someone who at some point in their life will receive healthcare, which is basically all of us, realizing that, in order for us to deliver good, high quality, gold standard care, we have to address healthcare worker burnout. And that means addressing staffing. We're finally starting to also talk about, healthcare work. A lot of times we refer to as superheroes, but I think that implies that we're also superhuman and that we're expected to, not address our own needs, but
Right.
you cannot pour from an empty cup. And I think that, a lot of younger physicians or student doctors are starting to learn and really experience this. And several years ago in the process that, places medical students into residency, for the first time in years, emergency medicine did not fill. We used to be, a competitive specialty, but I think that people saw a lot of the burnout, whether it's, overcrowding in hospitals, not having proper protective wear when taking care of sick patients with infectious diseases. People were taking a step back and deciding, you know what? This is not what I want to do, despite, having these altruistic beliefs and wanting to better the population, but to better the health of the population, but at what cost? So
Yeah.
I think that making healthcare a more hospitable field will address the burnout and giving physicians more time to spend with their patients. For instance, a lot of times primary care physicians only have 15 to 20 minutes to spend with a sick patient, and that's just not sustainable and it's not reasonable. And a lot of times these folks will just be end up being sent to the emergency department because you can't address someone's, urgent needs or long-term chronic needs and their questions in a 15 to 20-minute burnout. So I'm sorry, in a 15 to 20-minute appointment without leading to burnout. So I think that, addressing, the kind of softer sides of medicine, making it financially feasible for physicians in primary care and in private practice to take care of patients in ways that make them feel comfortable are ways in which we can build a more robust healthcare field as well. Um, we also talk about, healthcare inequities and access. Insurance does not always equal access. And you think, well, if you have insurance, you go see your doctor, right? Well, if you have insurance, but that primary care doctor, a wait appointment is 6 months to a year, do you really have access?
Right.
And I think that's a problem as well. Of course, particularly if you're living in certain rural or urban areas where, there just aren't primary care physicians, or even more and more, we're seeing OB-GYNs less likely to practice in certain areas due to restrictions on the type of reproductive care that they're able to provide their patients. So, to no fault of their own, some patients, despite their best efforts and signing up for insurance or paying for insurance, or even if they have it through their own jobs, they just don't have access, and that is making it difficult for us to care for our patients. What could have been a 15 to 20-minute appointment to refill your antihypertensives becomes an emergency department visit for a stroke because you didn't have your medications or access to care. And these are things that I think we definitely need to change in the healthcare system. There are challenges that not only produce worse healthcare outcomes, but it's also financially more expensive for the country as well to take care of sicker, aging populations.
Yeah, yeah. I certainly agree with that. I think that access is a huge problem, and I only have become aware of, you mentioned the lack of OBGYNs, that there are actual like OBGYN deserts in Georgia,
Hmm.
like where there are
Hmm.
no OBGYNs to take care of, a population of patients, which is, I mean, in the United States, it's like unheard of, right? That we would even have such lack of access, for patients. So that is definitely, a concern. And then also, like you mentioned, just trying to make, medicine and make healthcare attractive to people who
Yes.
want to, who really want to help, who want to help take care of patients, making it, you know, um, like you said, just more attractive to want to stay so that there's no burnout and so that we don't have a shortage.
Yeah, and part of that attractivity also comes with affordability as well.
Affordability, absolutely.
Right. I know a lot of folks are aware of the fact that, student public service student loan forgiveness is, coming under attack. And,
Yes.
particularly for, underrepresented students, or those who have been minoritized, first generation students, they may not have the same financial resources to go to medical school. Have invested hundreds and hundreds and hundreds of thousands of
Yes.
dollars,
Yes.
into my education. For some people, it's just not an option. And one of the ways that I was able to do that was through, parental support, and as well as, public service loan
Mm.
forgiveness. And with that on the table, that's going to greatly change the diversity of the, physician pipeline that we've talked about is so pivotal to taking care of, diverse populations. And we're definitely going to see a change in the face of the healthcare workforce as well if public service student loan forgiveness is not an option.
Yeah, yeah. Yeah, that was so real heartbreaking to hear because not only, you mentioned the number of people, especially from minority communities or low income communities that are going to lose the ability to be able to afford the education, but also we provided a service to those
Hmm.
areas. So the
Hmm.
people who are going to lose access to healthcare from those doctors who then committed to stay there, to practice and to give back, patients are also going to lose as well. So,
Absolutely. Hmm.
yeah. So, this has been a very intriguing conversation. You've shared so much with us here, a lot for us to think about, in terms of the years to come and what healthcare is starting to look like and how we can impact and make a change. What can you offer our listeners? Because, you do a lot, and there are a lot of us who carry, this advocacy work, and we're very
Mhm.
passionate about it. And, we do a lot of things sometimes outside of, our, day to day of taking care of patients. So, what tips can you share with our listeners about thriving in the face of adversity and having to sometimes carry this load, but then also taking care of yourself?
Of course. So I've given this question a lot of thought. And I think the first thing that I would like to lead with is that rest is radical resistance.
I
This
love that.
capitalistic society makes us think that you need to earn rest and you must always be producing. But as I said before, you cannot pour from an empty cup. You must take care of yourself. You can't always be coming from, a place of, yes, maybe anger and or fatigue to do the work that we do. Some of the work that we do must also be led by love. And in order to do that, you must be rested.
Mm.
I think the other thing that is important is we need to rely on our communities. No person is an island, and I say that both professionally, your professional communities as well as your personal communities for support. I think that being in medicine, particularly in the work that we do, depending upon the community that you're in, you might be siloed in areas where certain types of advocacy for, particularly for diversity, equity, and inclusion, social justice work is not always supported. So make sure that you have professional and personal support because some days, you just won't have the strength or the wherewithal to keep going. And it's important to surround yourself with positive people who support you in all aspects of your life and to keep you going.
Mhm.
And I think that this is important, particularly for women, is that no is a full sentence. You
Yeah.
need to, prioritize your time. And I think that, as I'm kind of moving away from becoming junior, I'm no longer junior faculty and kind of more mid-career, you need to be very specific about how you spend your time.
Yeah.
And if something does not serve you, whether it be personal or professional, then it's okay to say no. So don't place yourself in situations that are setting you up for failure. I think a lot of times when it comes to leadership, particularly Black women in leadership, we're looked to when it's time to clean up someone else's mess. We may not have the support, we may not have the resources to do so, and their expectations may be unrealistic. So you need to make sure that and that's where you draw on the community again, where you kind of think about what makes sense for me, what's best for me, whether it comes to my personal professional time. And sometimes, you owe it to yourself or
Yeah.
even the organization that you hope to serve to say no, because time is one of those resources where you never know how much time is left. So it's important that you fill your time with ways that, fill your cup and serve your purpose.
Yeah. I love those. I love those. And I will take heed to those as well as well. So rest, community, and no is the complete sentence.
Yes,
Yes.
yes.
I love all three of those. Well, thank you so much. This has been a very eye-opening and wonderful discussion. I hope to maybe have you back again later on,
Yes.
as we get further out with some future episodes. But anything that you want to share with the audience at all?
Sure. I continue to discuss a lot of these topics in more detail on my podcast, Culture Shock Therapy, Your Health Equity RX or prescription, and it is available on all major podcast platforms. Also visit me on my website, katrinagipson.com. It's Katrina like the hurricane and Gibson with a P. And, I really appreciate your platform and taking the time out to chat with me.
Absolutely. Absolutely. So go listen to her podcast, everyone, because I'm definitely going to go over and listen as well. Well, thank you again.
Thank you so much for having me.
Okay.